hold scapula in anatomical position. What are the things you have to remember for any bone, for any viscera? First thing is that superior, inferior. You have to remember. So superiorly expanded end and inferiorly pointed end. Okay. Superiorly has got spinous process, acromion process, coracoid process, glenoid cavity. All these things are superiorly, and inferior angle, the pointed end is inferiorly. Next, anterior and posterior. So this fossa, which is called as subscapular fossa, is anteriorly concave fossa, that is anteriorly, and this spinous process extending up to acromion process, this process is posteriorly. So superiorly broad end, inferiorly narrow, then anteriorly concave subscapular fossa, posteriorly spinous process. Now medial and lateral. If you feel it, palpate it, you will get one thin border and one thick border. Thin border is medially and thick border along with glenoidal cavity is lateral. Okay? So again I am telling superiorly broad end, inferiorly narrow end, anteriorly concave fossa, posteriorly spinous process, medial border is thin, lateral border is thick with glenoidal cavity. And side of the glenoid cavity determines side of the bone. Hence it is a right-sided scapula. Okay? So this is anatomical position and side determination. Next, some gross feature. Gross feature, first thing, it is a bone of three. So three angle, inferior angle, lateral angle and superior angle. Then we have three border, superior border, then lateral border and medial border. Again three processes. This is spinous process extending up to this part is called as acromion process, and this is coracoid process. So three angle, three border, three processes. Regarding surface, it has got two surface. Anterior surface is concave, which is also called as subscapular fossa, and posterior surface subdivided by this spinal process into two fossae. Inferior fossa is called as infraspinous fossa because it is below spinous process. Below spinous process, so infra. Here sub term is less used, infra term is more used. So infraspinous fossa, and here supra, above spinous process, so supraspinous fossa. So these two fossae together forms the posterior surface, which is more or less convex actually, but still called as fossa because each part is somewhat having a hollowness from where there are origin of muscles. So you have got three border, three angle, three process and two surface. Again the posterior surface is subdivided into two fossa. Now coming to other things, here there is on the lateral aspect, lateral angle, near lateral angle, there is a concavity, that is glenoidal cavity. It is the socket part of the ball and socket, shoulder joint. This glenoid cavity, just above glenoid cavity there is a tubercle. Tubercle means small tuber. This is supraglenoid tubercle, and this is again infraglenoid tubercle. Here subterm is not used, here infra. So above glenoid cavity supraglenoidal tubercle and below infraglenoidal tubercle. These are two tubercle present here. Now coming to the notches. Here you can see on superior border there is a notch. That notch is called as suprascapular notch. Suprascapular notch, and in between this acromion process and glenoid cavity there is a notch. Okay. Acromion process, and along with this is spinous process. This is spinous process extending to the acromion process here. So this notch is called as spinoglenoidal notch, between spine and glenoid. So it is spinoglenoidal notch. These two notch together, if you join from here, this is the most constricted part of the scapula. So here also there is angle of torsion between the weight transfer. Humerus weight goes like this and scapula weight going like this. So here there is also cutting end of two weight transfer line, and here also it is very constricted. So here there is every possibility of fracture. So from suprascapular notch to spinoglenoidal notch, if we draw a line and extend it and encircle it, this is surgical neck of scapula. And just at the margin of glenoidal cavity where capsular ligament attached, this rim is called as anatomical neck of the scapula. Two neck, anatomical neck, and this is surgical neck. Now coming to the particular feature. Regarding particular feature, here head of the humerus attached, and here there is attachment of clavicle. Now coming to the ligamentous attachment, here there is capsular ligament attachment, and from coracoid process to humerus there is coracohumeral ligament. From acromion process to humerus there is also ligament. These two ends are also connected to each other and forming a larger socket for humerus. So there are some ligaments in this lateral end. Now coming to the muscle attachment. Muscle attachment, first of all, this concave anterior surface, which is also called as costal surface because near to the ribs. Costal is adjective of ribs, prefix for ribs. So this surface is called as subscapular fossa, and from here the muscle originate is subscapularis. On posterior aspect, this area below spinous process is called as infraspinatus. From infraspinatus muscle origin, infraspinous fossa. From here infraspinatus muscle originates, and above spinous process, supraspinous fossa, there is origin of supraspinatus muscles. Okay. Just at the margin of supraspinatus muscle, there is a muscle insert here that is for elevation of scapula, that is called as levator scapulae because it elevates the scapula. Okay. So that is why it is called levator scapulae. Here there is also an insertion that is a omohyoid muscle which is coming from neck. Now rest of the thing, here anteriorly, here there is also insertion of serratus anterior. Serratus anterior is a multipinnate muscle. All the digits from upper ribs, they appear like this and insert into this border of the scapula. So origin point is serrate like karat ke jaisa, serrate like. So that is why it is called as serratus anterior. Then you have on posterior aspect, this border is for rhomboidus minor and rhomboidus major, and this border is for teres minor and teres major. Teres minor also take origin from two sleeves, and in between that two sleeves there is entrance of a nutrient artery. Okay, and here there is teres major, and at inferior angle there is latissimus dorsi. Latissimus dorsi is the only muscle which connects between upper limb and lower limb, more precisely which connects between pectoral girdle and pelvic girdle. Okay, then some other muscle attachment. This is spinous process and extending to the acromion process. Now here there are two muscle attachment. On upper margin there is deltoid, and lower margin there is insertion of trapezius muscle. Here there is origin of deltoid muscle. Okay, so these are, and from here there is supraglenoid tubercle, and this is infraglenoid tubercle. From this supraglenoid tubercle and infraglenoid tubercle respectively origins long head of biceps brachii and long head of triceps brachii. Okay, and from this point coracoid process there is also attachment of another origin of another muscle, that is coracobrachialis. Coracobrachialis originates from here. So these are the muscle attachment, and before that we have seen anatomical position, side determination, gross feature, and muscle attachment is the particular feature. This one.